Hi, this is Dr. Bharadwaz. I am CEO and Chief Doctor at Fidicus Homeopathy. What are the precautions you need to take for psoriasis? Once the psoriasis is detected, so do not use soaps and detergents, avoid them. So, if there is any infection in the body, especially on the skin, get it treated immediately. So, you can do plenty of sun bathing or sea bathing. You can go to sea and you can enjoy there. So, try to expose your skin to ultraviolet rays. This will decrease the psoriasis. Have regular checkup for other autoimmune. This is the most important thing. So as I said, this is not only a local skin disease, it is a systemic disease. So you have to watch out for other autoimmune disorders like thyroid disorders or pancreas, which is expressed in the form of diabetes, or intestinal disorders in the form of Crohn's disease, or any autoimmune red blood cells destructing diseases. You have to watch out for all this. So take plenty of fish, take naturally grown fish, especially don't take the fish that are artificially fed with corn and other supplements. Sea fish are good. Do plenty of exercises, lifestyle modifications, obesity and smoking, or diet you have to take. So you can take plenty of fish. Fish is good. Fish has EPA and DHA. So avoid dairy. Fish will suppress or decrease your psoriasis, and avoiding dairy will also uh, check the exaggeration of psoriasis. So what type of diet you have to take? Take plenty of green leafy vegetables. It will have they are rich in minerals, they are rich in vitamins, they are rich in fiber. So this is very healthy diet. Take plenty of nuts. So plenty of pulses you can take. So apart from this, you can take a good amount of non-vegetarian food, but very less quantity. Don't overdo the non-vegetarian food. This is the diet you have to take in psoriasis. And what type of exercises you have to do in psoriasis? So first exercise you have to do is aerobic exercise. What happens in aerobic exercise is it will regulate the uh, glucose metabolism. It will decrease the insulin resistance. By these two things, you will regulate the glucose. How to do the aerobic exercise? Aerobic exercise, you can walk briskly, or you can take a swim, or you can ride a bicycle. But what is the intensity you have to do? The intensity is, so this we call as a zone 2 cardio. In zone 2 cardio, what happens is there will not be any huffing and puffing. So you will be breathing out and breathing in with your nose, and there is no huffing and puffing. There is no extra oxygen you will be demanding. In this, what happens is, here fat is the substrate for energy. So you will get the fat into the system, you will burn the fat, and you will produce the energy, so that you will become lean, you will become thin, and your metabolism is regulated. Next exercise you have to do is hit high intensity interval training. In this, what happens is, this is zone 4 cardiac exercise. In this, what happens is, you go all out for 1 minute with high intensity, as much intensity as possible, for 1 minute, and give the rest for 3 to 5 minutes. In this, what happens is, growth hormone is released and testosterone is released. Growth hormone and testosterone are very good hormones, anabolic hormones. They improve your immunity, they optimize your immunity, and you will be free of diseases. On top of it, you can do uh, mid endurance duration means, so this is zone 3 cardio. In that, what happens is, a vague description of it is, you can inhale through nose and exhale through mouth. This is in between zone 2 and zone 4. This is called zone 3. In zone 3 exercise, you have to do for at least 10 minutes. 10 You can do anything. You can ride a bicycle, you can swim, you can jog, you can do anything with zone 3. If zone 3 is a medium intensity means you will have huffing and puffing, but it is not as much as in zone 4 cardio. So here, what happens is, you will regulate, your endurance is increased here. So your cardiac parameters are increased here. So you'll have good stroke volume, and you will decrease the resting heart rate. These are very useful exercises in case of psoriasis. All these are directing to release of growth hormone, release of testosterone, increasing your cardiac health, optimizing your immunity. And what type of lifestyle changes you have to make? Stop smoking immediately. Stop taking alcohol immediately. So reduce obesity. And also, if you have any addictions, you have to come out of the addictions immediately. So in addictions, what happens is, your basic dopamine levels are decreased. Then you will not feel pleasure in any of the activities other than these addictions. So you have to come out of these addictions and lead a healthy life. And one more important thing in the lifestyle is sleep. There is no organ in the body or no system in the body that is affected by deprivation of sleep. If you deprive sleep, every organ, especially your immune system, is more prone to derangement if you don't sleep. At least 7 to 9 hours of sleep is essential every day. So how do you sleep? So there are plenty of tips you can follow. So at least visualize sunlight 20 minutes in the morning, 20 minutes in the evening, so that your biological clock or your suprachiasmatic nucleus is set with the correct biological clock. So avoid waking up. So even though if you wake up in the middle of the night, don't watch the phone, because it will decrease the melanin synthesis. If you have sleep disorders, do not try to sleep in the afternoons, so that your adenosine will be at the peak in the evening, so that you will get good sleep. Stop looking at phone at least 1 hour before you sleep. So try to sleep at a regular time every day. Maybe if you are going to sleep at 10 o'clock, try to go to sleep at 10 o'clock every day. So by following these simple tips, you can improve your sleep. So diet, exercise, lifestyle modifications are very important in case of psoriasis. So have this habit. What happens if you don't treat the psoriasis effectively? So as I said, this is not a skin disease. This is a systemic disease where you have autoimmune derangement. So you can get Crohn's disease, or you can get diabetes, you can get a thyroid related disease, you can get intestinal related diseases, any other autoimmune disorders you are prone to get. Next, what is the prognosis? What happens if you don't treat the psoriasis effectively? So, as I said, this is not a skin disease. This is a systemic disease where you have autoimmune derangement. So, you can get Crohn's disease, or you can get diabetes. You can get a thyroid related disease. You can get intestinal related diseases. Any other autoimmune disorders you are prone to get. So, even though you get treated this psoriasis with allopathy, these disorders are not going to go, because in allopathy there are no drugs for them to reduce that autoimmune tendency. So if there is autoimmune disorder, they will suppress it. So until you take the drugs, they will be in control. When you remove the drugs, it will rebound. So there is no drugs for them to remove the tendency. So see, so same stress and same physiological factors you are exposing, another person is also exposing. What is the difference between you and that person? That is a tendency. There is no medicine in allopathy to remove that tendency, but in homeopathy we have very good medicines to remove that tendency of autoimmune disorders. One more serious form of psoriasis is psoriatic arthritis. When the psoriatic lesions are not treated with homeopathy for at least 10 years, within 10 years, you will go into psoriatic arthritis. In psoriatic arthritis, mostly it will affect the small joints, your fingers and toes, and all, mostly small joint, but also it occurs in larger joints as well. It will start from simple pain, redness, swelling, stiffness, or deformity, or so this will be sometimes symmetrical, sometimes asymmetrical. Means you will have, if there is pain in little finger, sometimes will have pain in both little fingers, sometimes only in little finger. So these are the simple forms. In serious forms, what happens is your bone get degenerated, or your periosteum get degenerated. Bone is completely degenerated. Instead of your fingers having 6 to 7 centimeters, they will become 1 centimeter. So such a disruptive disease is this psoriatic arthritis.